This is Dr. Steve Horwitz with Dallas Sports Academy. Here is a great chart provided by Grassroots Health discussing disease incidence prevention and vitamin D levels. Like we always say, you must measure in order to know instead of guessing. What this chart shows is on the left a number of diseases, and on the right the disease incidence prevention by the level of vitamin D in the blood. And as you can see, the level of 40 to 60, that's nanograms per milliliter, but that's the way we measure it in the United States. So a level of 40 to 60 provides the best protection in this case for all these different diseases. Now, what this chart is based on is it reviews 15 peer-reviewed studies, and it uses a reference level of 25 nanograms per milliliter, which means that the percentage reductions are based on raising the levels from 25 to the amount shown on the chart, basically that 40 to 60. So get your blood levels checked, know what you really need with regard to vitamin D, and then supplement as necessary, and better yet, just get out in the sun. When it comes to sun exposure and vitamin D production, if you live north of the 30th parallel, which is basically north of Atlanta in the United States, about half the year you will not get significant vitamin D production from sun exposure. So that is a definite consideration based on the geography of where you live. You need 20 minutes or so of exposure, or what we call more accurately the minimum erythemal dose. That's the dose of sun needed to cause a little reddening of your skin, and then you know that your body is going to produce the proper amount of vitamin D later that day. Don't be afraid of sun exposure. Just keep it to those limits, and it will be safe for your skin and will improve vitamin D production in your body. If you cannot get outside during the day and get that sun exposure, then supplementation will be necessary.